Hi, my name is Annette Gowron, and I will be presenting type 2 diabetes. Type 2 diabetes is known as the non-insulin dependent diabetes mellitus. It happens when the insulin your body makes is not used properly. This is generally attributed to poor lifestyle. The average onset of type 2 diabetes is generally between ages 45 and 64. In fact, it used to be called adult onset diabetes, but since there is a growing prevalence in children, it is no longer referred to as that. It is predicted that by 2050, the number of cases of type 2 diabetes in people under 20 will increase by up to 49%. There are several risk factors to getting type 2 diabetes. The most significant of these is being obese or overweight. In fact, 85.2% of diabetics are either overweight or obese, according to the American Diabetes Association. Many of the other risk factors correlate to this, including sedentary lifestyle, vascular diseases, and high cholesterol. Additionally, family history or a previous history of gestational diabetes are also risk factors. In case you're not familiar with gestational diabetes, this is the diabetes that only occurs during pregnancy. There are several high-risk groups in the United States, and these are Latinos, African Americans, Asian Americans, American Indians, and Pacific Islanders. There are several notable signs and symptoms for type 2 diabetes. These include urinating frequently, being thirsty all the time, getting tired often, having blurred vision, or noticing cataracts have formed, and also noticing that cuts do not heal as quickly as they used to. However, these signs and symptoms vary from individual to individual. In fact, some people do not even experience symptoms at all and can go for 2 years or more without knowing that they have a condition. Many complications can occur with type 2 diabetes. This is because there's so much glucose in the body that things like glycation can occur. Too much glycation can result in organ damage. The organs generally affected are the eyes, which can present with cataracts, the kidneys, and the nerves. When the nerves are affected, diabetics can lose sensation in their feet. If the person injures the bottom of the foot, the injury may not be noticed and can get worse and worse. In really bad cases, the person may need to get the foot amputated. And this is why we check for ulcers and sensation during our SGU public health fairs. Furthermore, macrovascular complications such as coronary heart disease can occur. There are several ways to diagnose type 2 diabetes. I will only discuss 2 of them. The first is the hemoglobin A1C test. This test is done by a doctor to read the patient's average blood sugar over the past 3 to 4 months. A reading greater than 6.5% is indicative of diabetes. The other test I will discuss is the oral glucose tolerance test, which I will go into a little more detail. This test is a gold standard test for type 2 diabetes and is extremely valuable because not only does it identify a patient with diabetes, it also identifies a patient with prediabetes. This is extremely significant because the prediabetes stage is the best stage to make lifestyle changes. Once a patient actually gets type 2 diabetes, it's extremely difficult to go back. The way that the oral glucose tolerance test is done is by having a patient come in to the doctor's office in the morning after having fasted overnight. The doctors then give the patient glucose and measure the glucose every half hour for up to 2 hours. Here is information on what the different results signify. A diabetic would have a fasting glucose level greater than 100 and a 2-hour glucose level greater than 200. This graph is an excellent representation of the progression of diabetes. As you can see here, in the pre-diabetes stage, the insulin secretion increases from the normal level. This happens because the body isn't responding to insulin as well as usual, and therefore the pancreatic beta cells must produce more insulin. Eventually, the beta cells start to get fatigued, and insulin secretion starts to drop. When insulin secretion gets down to this point, that means that the beta cells are so fatigued that they stop producing insulin completely. This is usually only seen in chronic type 2 diabetics. At this point, the type 2 diabetic must start injecting insulin. Usually type 2 diabetics do not have to inject insulin unless it gets to this point. There are several ways to prevent type 2 diabetes, and the most significant are weight control, exercise, and dietary changes. Limiting alcohol consumption as well as quitting smoking if you're a smoker are also good ways to prevent diabetes. Once you get diabetes, things get a little bit more complicated. Lifestyle changes must be made and blood sugar levels must be frequently monitored. This can be done by a simple finger prick test several times a day. Blood sugar levels should be kept within the range that your doctor recommends. Furthermore, if you have type 2 diabetes, you must pay special attention to the timing and dosage of your medications, especially if you're chronic and require insulin injections. If you do not need insulin injection, if you do need insulin injections, the insulin must be stored properly. Many types of insulin need to be refrigerated. Furthermore, diabetics must pay attention to other medications, especially over-the-counter medications, to make sure that they don't affect their blood sugar levels. Lastly, diabetics are recommended to check their feet frequently for the reasons I stated earlier on. This concludes my presentation. Thank you very much, and please email me with any questions or comments.